So safe sex is great sex. Better wear a latex, because you don't want that latex that I think I'm latex. So wrap it up. I'm Dr. Vo. I'm a family physician here at First Primary Care, and I'm here to discuss about birth control in our model. So at First Primary Care, we have several options. Your doctor can prescribe you the oral birth control pills, which you take at the same time every day. We have a patch that you can change once weekly for 3 weeks. You take it off for a week and then repeat the process the next cycle. Your doctor could also prescribe you the NuvaRing, where you insert it like you would a tampon for 3 weeks. You would take it out for a week and then repeat it again. There's also an injection that you can do. It lasts for 3 months, so every 3 months you will come back for that. We also offer the implant, which can be inserted in your non-dominant arm. And then we also have intrauterine devices, which are IUDs. And there are there's a hormonal and a non-hormonal type, and it can last from 3 years up to 12 years. Now, with birth control options, there isn't really a one-size-fits-all, so it's best that you discuss it with your doctor and your care team to see which one fits best for you and your lifestyle. And with the birth control options that we just discussed, I do want to make note that it doesn't protect you from sexually transmitted infections or diseases. You need barrier methods for that. Because we're on this subject matter, I do want to share some rap lyrics that has gone with me through my training. So safe sex is great sex. Better wear a latex, because you don't want that latex that I think I'm latex. So wrap it up. So that's Lil Wayne Lollipop Remix. Pricing can range. So birth control pills can be as low as $4 a month. If you do the injection, it lasts for 3 months, but it's less than $40. If you go towards the implant or the IUDs, they are a little bit more costly in the hundreds, but again, it does last for several years. So at First Primary Care, once you've decided which birth control route you want to go to, your doctor can send that prescription to your pharmacy or send it to a specialty pharmacy if you chose to go the implant or IUD route. Now, in the other traditional models, the clinics will charge you for the insertion and removal of the implant and IUDs. With us, it is included in the membership, so there's no cost to our patients. So for me, the most significant difference between getting birth control with the DPC model versus the other traditional models is that you have that direct access to your physician. Routinely, when we start a patient on birth control, typically the first 3 months, there's a lot of irregular bleeding and a lot of side effects, where even though we discuss it with our patients, when it's 2 months down the road, you always have that worry or that concern, and it's really nice that our patient can reach out to us and get their concerns addressed, or just get the reassurance that it's okay. Versus in the traditional system, at that point they would have to schedule another visit, and so it may have that delay. So it's just unnecessary anxiety for the patient and the delay in time. Another big difference, like how I said, we do not charge for the insertion and removal of the implants or the IUD. The other clinics typically do charge a fee. And lastly, just in general, for me, in the DPC model, we continually try to search for the best price options for our patients, and we want to share that with our patients as well. So not true. So typically, if you have like an acute illness or a non-related gyne issue, most OB-GYN specialists would refer you back to your primary care doctor. And I have found that some OB-GYNs prefer not to manage chronic conditions such as high blood pressure, high cholesterol, diabetes, and so again they will want you to have a primary care doctor. And one of the biggest misconception, which many aren't aware of, that your primary care physician can also give you OB-GYN care. So, for example, I am trained in family medicine, so I see babies all the way up to the elderly. But we also have a strong component where we study OB-GYN care. So we learn heavily on women's health, women's preventative health, all the way up to the prenatal, during pregnancies, and even delivering babies. So definitely reach out to your primary care doctor, because they can also take care of your OB-GYN care. If you'd like to learn more and have a direct relationship with your doctor, please go to firstprimarycare.com.